Are you coming in here? Coming to the conference?
Yeah.
Are you going to the new Savoy?
I'm Paul Atkinson. I'm a psychotherapist. Been a psychotherapist for 30 years. And I'm down here today to protest at the new Savoy conference that's taking place here on Hallam Street, where IAPT, psychotherapists and professional bodies, that's improving access to psychological therapies, are meeting really to sort of package and sell their latest sort of IAPT product to the government. And it's this new Savoy conference bunch that have been so active in supporting psychotherapy to get people off benefits and back to work. So that's why we've chosen to come down here today. These people who are very rational, are very liberal, and at the same time they're doing deals with the government, they're doing deals with the DWP, and they're backing the employment of a lot of mental health advisors who are off working in either job centres or GP practices and so on. So it's a disgusting relationship that's been developing really between the Department of Health, psychotherapists in the Department of Health, and the Department of Work and Pensions. And our message is, you know, this Tory ideology of work as a cure for mental health difficulties. This is like the chain gang. This is back to work is back to bullshit work, basically, isn't it? And it's also an incredibly coercive thing to do to people who have had quite severe long-term problems, have enormously difficulty holding down jobs, who basically need a lot of support, a lot of emotional and relational support.
They involve co-opting IAPT in job centres.
DWP is hiring hundreds of side professionals like us to practice unethically, using us to put psychological pressure on claimants to get them back to work. This has to stop.
We say no to IAPT in job centres. We say no to professional collaboration in job centres. And we said this is a message to the psychologists who are involved in this in job centres. We will name you, we will shame you, and we will shut down the job centres that participate in this horrendous scheme. You have been warned.
Thank you very much, Andrew, Paul and Paula. It's a very important debate, probably even more important after the Brexit vote. And it is a debate that we will be returning to at our conference in March. We usually devote the day 2 to this very subject. So I'll be very happy to engage with Paul and Andrew and Paula.
Free Psychotherapy Network, which is a network offering free psychotherapy to people on low incomes and on benefits. And partly we organised ourselves in response to the collapse of any real choice in the NHS as far as psychotherapy is concerned. So we now have a national network where we're wanting to offer what we consider to be real psychotherapy, open-ended psychotherapy that's based around the interests and the needs of the client. When George Osborne decided that he was going to put IAPT therapists into job centres, several of us were really totally outraged at this, if you like, latest step in the use of psychologists and psychotherapy to propagate policies of austerity and neoliberalism. We considered it to be really quite a kind of horrendous step in the direction that things have been going since at least 2006. And a number of us decided that we that we as therapists were now being coerced into a system that we did not agree with, that we feel is essentially unethical in the way that clients are approached. and the lack of choice that's available to people. And in particular, that psychotherapy was being used to support the DWP's punitive and very coercive policies towards mental health, people with mental health disabilities who are on benefits. And my colleague here, Paula Peters, is a member of DPAC and MHRN, will say something about what it's been like on the receiving end of those policies. What I'd like to say is that although, of course, it's a very rational and reasonable argument to make that people who are on long-term mental health disability benefits, who do want to get to work, who do want to be working and have the experience of being part of a working group and the kind of esteem that goes with working alongside colleagues, of course those people should be offered support of one kind or another to help them get a job if they're finding it difficult to get a job. What feels entirely wrong and deeply unethical, I think, is for we psychotherapists and psychologists to be working under the banner of the DWP, taking DWP money, when the ideology around social welfare generally and the attitude to people with mental health disabilities who are on benefits is extremely punitive. It's a system in which getting back to work is connected to the idea of people being scroungers on the welfare. And as we know, the whole welfare system is being undermined and transformed into, on our side of things at least, a kind of workfare system. So we therapists are now going to be standing together with service users and with workfare campaigners, and we are going to be coming at every opportunity. We are going to be presenting people with what we consider to be the unethical nature of using psychotherapists to get people back to work.
My name is Paula Peters. I'm on the National Steering Group of Disabled People Against Cuts, or DPAC as we're better known, and I'm a member of the Mental Health Resistance Network. I have to say that the last 6 years of this punitive government, we've seen services, mental health services, ripped apart and decimated. People being discharged back to the GP, where a GP has no mental health training, can't get hold of their GP because there's normally a 2-month wait to get one, if you like, an appointment if you're lucky. I faced in March of this year being discharged from mental health services. You may see me today and think I'm stable, but I'm not. I have rapid cycling bipolar, and it's taken everything to stand in front of you. And I want to share this with you. But 5 years ago, I went through the work capability assessment twice. The fear of it alone drove me in hospital. I was in a psychiatric unit for 3 months. The doctors were not allowed to use the words DWP, Atos, or Ian Duncan Smith in front of me. We had people in hospital who had their ESA 50 forms to fill out, who needed an increase of medication because of that. I had my medication increased because of what Ian Duncan Smith put me through. And I lost a good friend of mine to suicide over the DWP on the 16th of December 2010. There are thousands of people in mental distress, disabled people, who've taken their own lives because of the WCA, of being sanctioned, of losing their mental health services. Now in September last year, we heard that Islington was piloting their health and work programme with having Maximus job coaches based in GP surgeries. The Maximus job coaches having access to our medical records. Well, you put a Maximus job coach in a GP surgery, mental health claimants will not go into that surgery because they will see the GP surgery as a place of coercion, of bullying. And this is a message to GPs. Remember your ethics. Do no harm, because you did not become a GP to collaborate with the DWP and this government's rhetoric that employability is a health solution. I had a huge breakdown at my desk. I was a civil servant. I got absolutely no support at all. And even today, the civil service still discriminates against people who have a mental health condition. They did against me. If there had been the support for me back at the time, I'd probably still be working today, but there wasn't. And because of the overwhelming stress and fear that the DWP put me through, I was so stressed that the stress led on to my developing rheumatoid arthritis and fibro. I've been through the WCA process twice, and we're having people 3.3 million disabled people who've been cut, had 6 different kinds of benefit cuts. You want people to work, yet the government are cutting access to work support, putting barriers in place to stop us working, closing deaf and disabled people's organisations that are helping disabled people into work. Every barrier this government can think of to put barriers in place, they are doing. What I say to you today is a simple message. Remember why you become psychologists in the first place. It was to help people. It certainly was not to become a collaborator of the DWP. Now, I know that many of you may have been threatened by your professional bodies to speak out. We live with threats every day to speak out against this pernicious, evil Tory government. But the more of you speak out, the more of you will join in and resist this government, because without you, they can't push their policies through. And having IAPT in job centres, this is bullying, it's coercion, and more people in mental distress will die. People need support, decent mental health services to support them. They don't need to be bullied and coerced, because I will tell you this, you bully people, you coerce them, you will kill them. And when you look at your hands when you leave this conference and you get behind this government rhetoric, down the line you will look at your hands and you will have noticed that you are, if you stay silent on this, you are as guilty as the government in the collaboration of the deaths of people in mental distress. If you collaborate in working in the IAPT in job centres, you are as guilty as the government in the mental distress you will cause and the suicides that will result. You think of that when you leave this conference and you say no to this Tory government, no to these policies, and say enough is enough, we're outside on the street, take a leaflet and get behind us. Thank you.
The Big Five, the British Psychological Society, the UK Council for Psychotherapy, the British Association of Counselling and Psychotherapy, and the British Association of Behavioural and Cognitive Psychotherapists. These organisations are saying all the right things, but they have a real tension within them, which is that their members want jobs. And that mutes their opposition to the unethical and has been explained to you, dangerous policies regarding placing of IAPT in job centres. Now, having run one of these big organisations, I understand that tension very well. But it's absolutely clear it's time for those organisations that I mentioned to respond to pressure from their rank and file membership to do the right thing and not to tell people that they have had private and confidential discussions, unminuted, unreported discussions with the DWP, and therefore entirely reassure their memberships that the reassurance of the DWP is to be believed. That is not good enough. Those of you that are members of those Big Five organisations need to go to the leadership of those organisations and force a better response to what is becoming a crisis and a scandal. Thank you.